Hi folks, Steve the Hurricane here, and on today's episode of A Drink with the Hurricane, we are going to talk about families that are in denial about the amount of care that they need for their loved one. Cheers, A Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. So this particular topic came from Suzanne, who's one of my long-term, near and dear friends and client of ours since 2015. And she said that she's come across this situation so many times where they're in the house, they're talking to somebody who has dementia, and it's like advanced dementia. And the patient's family feels that, well, you know, we only want to get this amount of services when the person actually needs like this amount of services. So in the specific example that she had said to me, the family is suggesting 5 hours of care a day for a like stage 4 dementia patient who really needs help round the clock, either live-in or 24/7, at least 56 hours a week. And so what is the go-between? How do we get the family to open their eyes and realize what is actually at stake here and what the person needs? And this comes back to something that I have said at so many boot camps and so many events over the years. And that is, sell people what they need, not what they want. And that goes down to your sales process. You're sitting down with the family, you communicate on our experience as the agency, which we have taken care of. And I know, Suzanne, I know your business, you are like me in this. You've taken care of over 1,000 people since you started your business. Clearly, you know what a patient needs more than the patient, him or herself. This is their first or second time going through this as a family. You have been in this situation 1,000 times. So as the expert, we have to be willing to walk away from a situation that is unsafe. A dementia patient who's as advanced as some of these patients are, if the family's in denial about the care that they need, you do not sell that patient inadequate services, because when that person, not if, when that person wanders, when that person ends up missing, when that person ends up in the hospital, you're going to be the person that gets blamed for it because they didn't put enough care in place. Now, this is all assuming that resources are available. Another point that Suzanne asked in her question is, and many times she feels that families are pushing to move mom into a memory care place and think that that's the best way to go. And my response to that is, show them the cost. That's what you do. So if somebody is saying, I only want to get 5 hours of home care a day, 7 days a week, but we're thinking that we should move mom into a memory care, in where you're located in the United States, a memory care unit is like $9,000 a month. I think the average memory care unit around the country is $7,500 a month. So $7,500 a month is significant. Where you're located, $9,000 a month is significant. If you were to take the same level of services, and I'm going to do a math here, basic math, the average hourly rate around the United States right now is $22 an hour. So $22 an hour times $56 an hour, that's $1,232 a week. Now, 56 hours of care is 8 hours a day, 7 days a week. So that gives you basically $1,250. $1,250 times 4 weeks in a month, that's $6,000. That's $1,500 less than the memory care unit. Now, if you were to do a live-in, many states in the country have live-in services, and live-in is going to cost you in the ballpark of 12 to 16 hours per day as a daily rate for a live-in. So let's do $22 an hour, and we'll just go split the difference, times 14 hours a day. That comes up to $310. So that's like your average live-in rate around the country. So if somebody were to do $310, 7 days a week, that's going to cost $2,170 a week, which in a month's time is around $10,000. Now, $10,000 for the live-in, to your point, Suzanne, where you're located, $9,000 plus for the assisted living, memory care, it's almost apples to apples. But here's where the differentiator comes in. The memory care probably has one faculty member or one staff member, nurse, CNA, whoever, to 8 patients, 8 residents. So it's an 8-to-1 ratio. It's not 1-to-1. Home care, though, is 1-on-1. For a dementia patient who has memory issues as it is already, who it could be combative, could be argumentative, could be afraid of strangers and strange environments, familiarity is the most important thing you can do for that particular patient. What is the best environment for that patient? It's in her home. That's what's in the best interest of the patient. The dollar amount is almost apples to apples. We're very close here when you look at the live-in versus the memory care placement. It's almost apples to apples. And obviously, that's if you do the live-in. If you don't, you can do less and still have the same result. And then our price or the home care ends up being less. But the other advantage is it's 1-on-1. That is your key. That is the point that needs to be made. And then we hold on it. Like, it's one of those things where it comes down to price, because a lot of times people get very gun shy or price leery. If I go to an auto dealership and I want to buy a BMW, you're going to pay BMW dollars for that car. It is a BMW. They're not going to negotiate. They're not going to give you a discount. They don't have to. It's BMW. You know, if I go to the Best Buy around the corner, I can see Best Buy right out my window right here in my office. Best Buy, and I want to buy a Mitsubishi 70-inch television that has a plasma this and Ultra 4K that and everything else. I can't say to Best Buy, well, I'm not going to pay the $3,000 price. Best Buy is going to say, then this is not the TV for you. So it's the same thing from our perspective. This is what's needed. And if you're considering moving into a memory care, realize that the memory care may be great and may be your answer, but what's in the best interest of the patient? It's staying in the place that she knows best, 1-on-1 care to prevent her from hurting herself, wandering, or things that we can't even begin to imagine. And the cost, it's apples to apples. 9 times out of 10, staying at home, bringing in adequate care is the better option than moving into the memory care. And so that's how I would handle that exact situation. Suzanne, thank you so much for the question. And for those of you out there, you know, if you're getting these kind of challenges, if you want to scale and grow your business and you're having a hard time figuring out these kind of nuances, pick up the phone, give us a call, and let us help you do what you need to do so you can blow away the competition.